So today we're here with Leslie Wise. I'm excited to learn more about your career path. So to start us off, could you just briefly introduce yourself and your current work and how you got to where you are?
Sure. Hi, nice to meet you. Yes, my name is Leslie Wise, and I am currently working at Illinois Department of Public Health as an epidemiologist. I was initially hired on to look into data analysis surrounding opioids and overdose, and so that my actual title is an overdose epidemiologist. And since then, I've also picked up some work working with the Division of Oral Health, been helping with some of their data analysis. And then also shortly after I joined the department, I also joined the COVID-19 data intel team. So currently wearing a few different hats.
So I'm wondering if you can just tell us in a bit more detail, what are some of the skills that you use every day in your job? And was there anything that you really weren't prepared for from your science education that you need to do now?
So one of the things that I think, so a good grad school, a good grad program will really give you this opportunity to work with others, to collaborate with your science, and to collaborate with others in your experiment, pull in other lab members. And so there's some of that absolutely is working as a team with your lab in order to bring to move the science forward, right? So there is some of that, but a graduate program in itself is somewhat inherently isolated. You are expected to run this project, right? And you are expected to get this project to completion and write everything. You're writing yourself, right? Of course you have feedback, and of course you have other students there who are pitching in and they are willing to help, and you have other students, undergrads, whatnot, helping you. And so you do learn that. However, I think that one thing that was a little bit of a transition was learning how to really work with a team and to not be this is my job and that's your job. Not everything is just so clear cut, and then everybody gets to work together towards that goal. And I think that is something that I was not I somewhat knew it, but it's not something you can really quite 100% prepare yourself with until you're in the group, because you have different personalities, you have different people coming from different backgrounds, and you have to find a way to make all that work. And so I think that is one area where I was not as well prepared, just with the science background.
So what do you think are some of the really important issues in your field moving forward? And if you could implement any policy in this field, what would it be and why?
So some of the really important issues in the field right now are going to be towards reducing some of the stigma that is surrounding some of the harm reduction strategies, where we are trying to make people safe until they are ready to make their decisions on, keep people safe in the meantime. If they want to enter treatment, that's great. We have IDPH doesn't do the treatment part, but IDHS, our sister organization, does. And so, but we also want to make people safe in that meantime, right? Because addiction is a very complicated mental illness or mental condition. And so we just want to make people safe and save their lives during the time. And then they can make those decisions on their own as to where they want to go from there. So trying to reduce that stigma surrounding harm reduction, also reducing the stigma around some of the medication-assisted recoveries. That is an issue where people sometimes can think that they're not really in recovery if they're taking medicine for it, which you wouldn't say that to someone who with diabetes, right? So this is an issue that is something that we really want to help reduce that stigma. So I think that is one of the really large issues that's facing some of the overdose treatments at this point in time.
So, what I would love to know more about is the specific work that you're doing. So, can you tell us about some projects that you've worked on and what a typical project looks like for you?
Um, there's a couple of different projects that we've worked on. So one of the things, there is a state mandated report that goes to our legislative body for Illinois. We have to submit a semi-annual report twice a year that describes somewhat of the outline of overdoses in the state, kind of what that use the data that we have to give that picture. And so that's one report, one project that we put out twice a year. So we work towards that. Whenever the data comes available, put that out. And that's fairly straightforward, right? I mean, we're always using our scientific writing to really know how to take that from the science, and then know how to translate into a good product for both policymakers as well as the general public, because they're always public reports. And then another really major project that we've been working on, and it came out in, I believe 2017 was the last time, and then we're trying to get it out again this year. We have the state overdose action plan. So this is a really large interdepartmental, interagency report and plan to combat these, to combat this overdose epidemic that we're also seeing. So we work with the Department of Human Services very closely, and we also work with different departments. We work with the Department of Corrections, the Criminal Justice. We work with IDFPR, which I can't remember, professional regulations. And so it has fingers all across the state agencies in Illinois. And we also work with an advisory council, which is a public council. And so we get to hear public voices as well. It's not just the agencies. We get to hear from treatment centers. We get to hear from harm reduction centers. We get to hear from people with lived experiences, and we get to take their recommendations and what they say they feel as though we need to do in order to combat these issues. We get to take all of that information and put it towards this plan that will hopefully we can take actual steps to help combat these issues. So that is a huge, huge undertaking. Hopefully we'll be out here in the next couple of months, actually, but it couldn't be done by just one group. So hopefully that's a really large plan. So we go from having little projects where, okay, we need to write 2 pages and send that to the legislative bodies, to these huge projects that allow us to actually take steps forward and help the public.
So, as we finish up this interview, I'm wondering if you have any advice for someone who is early in their career and would like to follow in your footsteps, so to speak.
That's a great question. I would recommend just always know your worth, right? And everything that you do can teach you something, right? You've never wasted time. You have never went down a path and then it didn't work out, but that time's not wasted. That time is not lost. You learned something during that time. And so while you're going through these paths and while you're, trying to figure your way, just take everything that you learn is going to teach you something, and use that to promote yourself forward. And yes, always know your worth, because you are worthwhile. There's a lot of imposter syndrome. Everybody has imposter syndrome, and you are worthwhile, and you have that worth. And so don't ever put yourself down and think that you don't have what it takes, or somebody else should be doing this because it's not you. That was one of my things whenever I first started this position, was I thought, they want me to do that? They actually, I didn't realize, I thought there would be somebody else who would be making these decisions, not me. why would they want my opinion? And I kind of said that to my boss one day. I was thought that they would want somebody else to do this. Why would they want my opinion? And she said, well, that's why we hired you, right? Because you have the education, you have the background, you can make these decisions, and that's what we need you to do. And from then on, I was like, all right, I guess it's me. Let's do this, you know? So don't ever make yourself feel like you're not important enough to do this, because you are. And you are definitely worthwhile, and you can do it. So
That's a very motivating end to our conversation. So thank you so much for sharing your experience with us.
yeah, absolutely. Thank you.